Hello, my name is Benzor. This is my patient John Mark, and I will be doing an examination on him. So the first exam I'm going to do is a node exam. So I am going to first palpate the anterior cervical nodes right here. I'm going to go in a circular motion with 3 fingers. As I go down, if John Mark were to have an infection, his nodes are going to be firm. They're going to be enlarged a little bit. They're going to be a little bit tender, and they might be warm to the touch. Now, if John Mark were to have some type of cancer, such as throat or tongue cancer, those are going to be firm. They're not going to be tender, but they might be conjoined. They might be enlarged, and they're going to be fixed in one area. They're not going to be able to move around when you palpate. Then you have the posterior cervical, and those are going to dump their contents into the back of the head, in the neck area. And then superior and anterior to that, you have the tonsillar nodes, and those are gonna excrete back into the tonsil and pharyngeal regions. And then moving anterior to that, you have the submandibular nodes, and those are gonna excrete down into the bottom of the mouth. And then right underneath the chin, you have the submental, and that's going to excrete down into the auricle teeth cavity. So after nodes, we have ear. So on the exterior part of the ear, you have the helix, the antihelix, the nodes, and with this whole examination of the exterior ear, you want to be checking for any type of cancer. It also might show signs of an ear infection. So if the external auditory canal is going to be smaller in size than the other, that might show that there is swelling causing because of an ear infection. And then also the tragus and the antitragus are going to be have a little bit of pain to the touch. So after doing that, you want to examine within the ear. So with the auricles scope, I will pull back on the ear and insert it in. As you insert this in the tube in with the light, you should be able to see through the canal. There might be some cloggage from the wax, but as you move further in, you'll see the tympanic membrane. A healthy membrane, you should be able to see the malleolus, and the tympanic membrane should have a grayish color. It should be a little bit reflective, and then a tympanic membrane that might show some type of infection or pathology inside the middle ear is going to be red, have a reddish tint to it. It's not going to be a see-through. You're not going to be able to see the malleolus. It's not going to be shiny, as I said, and yeah, that's just what it's going to look like. So moving on, when you there are 2 different types of hearing losses. You have conduction, and then you have sensorial neural. So conduction is going to be a loss of sound in between the entrance through the ear all the way up to the cranial nerve 8. And then sensorial neural is going to be some type of hearing issue involving just the cranial nerve 8. So the different types of tests you can use, both of which are going to involve a tuning fork. I will be using a dinner fork. So you'll just do the pinch method to create that vibration, and your patient should be informed about how this test will go. But with the Weber test, with the fork vibrating, you'll place it on the top of the head. The sound should conduct via vibrations from the bones in the ear, which will create that sound. So if someone who has conductive hearing loss, they are going to hear a louder sound in that ear that has the hearing loss. And then if they have some sort of sensorial neural issue, that hearing issue is going to be present in the ear that you can't hear the sound as well. So then another test that you can do is the Ryan test. The Ryan test, of course, is the same pinch method. You're going to put on the mandible bone right behind the ear, and you're going to hold this until the patient cannot hear that sound anymore, and then he will tell you that, and you will bring the fork in as close as you can to the external auditory canal, and he will tell you if you can hear that sound. A normal patient with good hearing should be able to hear that sound. If they can't, that is a sign of conductive hearing loss. A patient with sensorineural hearing loss, when compared to the other ear, the ear that is negatively affected is going to have a shorter time for when the ringing starts to when the patient cannot hear it from this position. They should still be able to hear it once you move that fork in closer. So that concludes the ear. Now moving on to the nose. So the nose, I'm going to just outline a few of the structures. So you have the root, you have the bridge, you have the dorsum nasi, you have the ala, and you have the apex. So after identifying the external structures, we want to be able to look at the internal structures of this person's nose. So as I take the patient, I want to tilt his head back so I can see. I'm going to lift those nostrils up. And I want to be able to look and feel to make sure that breathing is uniform between each. And I'm going to use my scope to look in and recognize that there's no blockage. I want to look at the mucosa, and I want to be able to see that it's if it's red, then it's going to symbolize that there's some type of infection. I also want to check the discharge. If it's a clear discharge, then that's going to signify some type of allergy. If it is a yellowish tint, then that is going to signify a type of infection. Next thing you're going to look at is how well they can smell, so olfaction. So this is easy. You can use this with alcohol swabs or something, but you want to be able to have the patient close their eye and want to see if they can identify the object that you have in front of them. So I will just do a couple of random ones that I've found and see if John Mark can identify them. So this is the first one. Put it about 10 centimeters away. So what do you think that is, John Mark?
Some type of hot sauce.
That's correct. That's correct. And then here's another one. I'm just going to use this.
A little bit of that coffee.
Yep, that's correct. So his smell is correct. Can you smell this? Alright, that was just for fun. So after that, you can kind of gauge how well they can smell. Now moving on to the maxillary and facial sinuses. So the maxillary sinus is going to be located right here. The facial is going to be located above the eyebrow. Both of these, if you palpate them and they have some type of inflammation, there's going to be a lot of pain associated with that. Not a lot, but they will feel a little bit of pain. Another way to test is if there is no pain associated with that, you can shine a light down through the eye, down through right by the cheekbone, have them open their mouth, and you should be able to see on the roof of their mouth a light shining through. If there is no light shining through, that can also signify that there is some inflammation. Also, there's another test you can do by if they open their mouth, you can tap on their teeth, and that vibration should be felt on that sinus, and that will show a little bit of pain too. So that's another positive test you can determine to find out if they have any inflammation of that. Yeah, that is all I have for you today. Thank you for watching.
Mm-hmm.